my name is Amanda, and today we'll be performing the administration of the ophthalmic medication. And these are all my supplies. I have my hand sanitizer, gloves, gauze, the medication, as well as a rag here to go and clean the eyes. And I will go ahead and verify the doctor's order and make sure that I'm checking the correct medication. Also, I'll verify the 6 rights, which are the correct medication, patient, drug, dose, time, route, and documentation. And also make sure when I enter, I'll close the door for patient privacy, or the curtain, depending where you are. And then I will go ahead and introduce myself and just say, "Hi, Mr. Smith, my name is Amanda. I will go ahead and be your nurse today," and just let them know what I'm doing today, as well as verify the patient's first and last name and date of birth. Do you mind if I verify your first and last name? Great, thank you. Can I check your wristband to go ahead and see if that's correct? Great, perfect, thank you. So that all looks okay. I'll also ask for allergies. Do you have any allergies today, Mr. Smith? No allergies, thankfully. I'll explain that today I'll be giving him Tylenol, I don't think I'm saying that correctly, 0.25%, and I'm going to do 1 drop in each eye twice a day. And I'll explain that it's for his glaucoma, and he will feel some pressure in his eye, as well as when I administer the drops, I'll let him know that he could feel some stinkiness, and side effects are dizziness and fatigue, and like I said, he will feel some stinging and burning as well. Some adverse side effects I'll let him know are shortness of breath, and if that does happen, please let me know immediately, and I'll let him know if he has any questions. He has no questions, and we'll go ahead and get started. So I'll go ahead and perform hand hygiene here, get that going, and then I'll go ahead and put my gloves on here. Okay. Awesome. Okay. And then I'll make sure the patient's in a comfortable position. I raised his bed, put the side rails down, etc., just to make sure he's comfortable and I have access enough to go ahead and reach the eyes. And his neck is slightly extended position, so that seems to be doing okay. And I will also go ahead and check for any crusting happening in the patient's eye. And here I have my rag. I'll go ahead and put some warm tap water on it and go ahead and clean the eye as well. And so I'll go ahead and start here with the inner campus, and I'll start with the eye closest to you. So I'll go ahead and clean, starting from the inner campus, hold it there for about a minute or 2, and then just wipe outwards to the outer campus. And then I'll pick a different part of the rag and do the same thing. Go ahead and start with the inner campus of the eye and hold it there for a minute or 2, and then go ahead and wipe out. Perfect. And now that the patient's ready to go, I'll go ahead and toss this in the trash, remove my gloves as well, put that in the trash, and then I'll go ahead and perform hand hygiene again, and go ahead and reapply my gloves again, making sure the patient's okay, seems to be doing all right. And like I said, no questions. And then I'll go ahead and grab a gauze and tissue and put it on the bony part of the orbital cheek. So I'll go ahead and do that here. And with my thumb and forefinger, hold that there with and then with my non-dominant hand, go ahead and grab the medication, open it here, go ahead and let him know that I'm going to go ahead and add the medication now. And I'll rest my hand on the forehead and have the patient look up. And I'll do 1 drop in the lower lid. Squeeze that. Great. And then also remember, if the patient does blink and the medication does not make it in the eye, you'll have to repeat all of that again. And now we'll go ahead and move to the other eye and get another gauze. And then we go ahead and turn it so you can see the patient. Okay, and then same thing. I'll go ahead and hold it here and have the patient look up, drop it in the lower lid, and if I need to clean any medication that's dripping out, I can go ahead and clean that as well here. And again, the patient blinks and the medication does not make it in the eye, you will have to repeat it. And there is a systemic effect. If there is, you can use a tissue and then hold it down into the nasal lacrimal duct. Hold it for about 30 to 60 seconds there. And all right, so I went ahead and did the eyes there. That's all done. I'll go ahead and throw everything away, take off my gloves, and I think that is it. And then I'll go ahead and thank the patient, do hand hygiene, document my procedure, and make sure I'm documenting the correct things, like the right patient, the right time, the right drug, and the right dose, and make sure that he's comfortable, make sure that his call light is there, and if he needs to do anything else before I go. And that's all. Thank you.